Now, I'm going to open up my catheter. And what I'm going to do here is I'm going to take my cap off. I don't want to talk over it, but all I want to do is twist the blue around, and all that does is loosen it up so when I go to thread it off the needle that it's not stuck. Then I'm going to gently put my cap on. What I want to be careful of is, see that white button on there? If I touch that white button, it's going to retract the needle and I'll have to get a new catheter. So I just kind of set it in there. Then when I'm picking my IV, I can actually set everything up after I find the vein or before I find the vein, just like I did. It kind of depends on your patient's history and all that kind of stuff. So what I'm going to do is I'm going to check my pulse first. Why do I check a pulse first?
For baseline.
Baseline. I need a baseline, okay? Then I'm going to put my tourniquet on, and I'm going to check my pulse again. Okay? Now I'm going to find my vein, and I'm going to choose a vein that I like. I'm going to look on both sides of the arms so that I can actually choose the one that I want to do. Okay? And then I'm going to disconnect my tourniquet. Okay. So if I have found a vein beforehand, before setting everything up, I can actually set everything up, put my tourniquet on, check my pulse, and leave my tourniquet on for the entire process of doing my bleb and doing my IV. As long as my patient's arm's not turning blue and their circulation is okay. It says less than 2 minutes, but some people can handle it longer than 2 minutes and some people can't handle it 2 minutes at all. So it's going to be based off your patient. For students, because you guys are just starting, I recommend doing your bleb and doing the tourniquet, getting yourself organized, because if not, what happens is the patient's going to be sitting there for 5 minutes, just because it's so new. And I recommend wearing a pair of gloves that fit you, not ones that are too big. My tourniquet goes back on. I'm going to check my pulse. Okay. Not sure how this goes. Check my pulse. And now I'm going to do my bleb. And I'm going to use this vein right here. So I'm going to clean. This is just like a TB.
Emily, they said, did you do it beside the vein or on top of the vein?
I would do it right where you're going to poke for your IV. So I kind of go right on top of the vein.
So it's kind of like you doing a TB test.
It's like a TB test. Okay, then I'm going to undo my tourniquet because I'm a student. I'm going to get my little ChlorPrep ready. Now, with my ChlorPrep, I'm going to break it. I'm going to do is squeeze it. And right where my bleb was, or is, I'm going to hold it for a count of 10 seconds. What that does, it allows that lidocaine to disperse into the tissues. So I do a count of 10. Now remember, ChlorPrep, we can do one big swipe and then some little ones, or we can do around in a circle. I still do around in a circle because that's what I've learned, but you could do either way. And around. Let me get rid of. I'm going to put my tourniquet back on. Check my pulse. Grab up my catheter. Now, I like to hold my IV catheter like this. It has those two little things right in there. I like to hold them just like that. So then I can see flashback. I want to have my bevel up when I do it. Now, my thumb on my other side, and I want to have my hands like this. It goes right to the side of the vein, and I'm going to pull down. Side of the vein, and pull down. And I go about a 15-degree angle. I go in. I see flashback. I advance it just a little bit more. I release my tourniquet. Now, the hand that has the IV, I do not move. I now come up, and there's a little flange on this catheter, and I go ahead and thread it off of my needle. I then want to occlude with this finger or this finger. Occlude, and then I want to pinch my blue hub with those. And I do not want to touch it where it goes into the skin. I'm then going to push my button. Lift up. I now need to get this little cap off. Screw it on. Now I'm good. Now I can let go. I'm going to aspirate, and I'm going to flush. Okay. Flush, flush, flush. Now I cannot take my gloves off until I get it taped. I take one little piece of tape, and when I tape, I want to tape on the blue part. I don't want to get where it goes into the skin, but just right. So halfway between the screw cap and where it goes into the skin. Takes a lot of hand dexterity, but once you get it, it's muscle memory. Your next piece of tape goes right over where the other one did. You're going to take your tegaderm. And your tegaderm is going to lie right up next to the cap. And you're going to pinch it around. And once you get that on, then you can take your gloves off. I take my pen and I write today's date and my initials in the gauge. Pull this off, and I want to lay it right next to where it goes in. I don't want to lay it over the top because I want to be able to see it. I then take my next piece of tape, or more tape, and secure it on. We have something that looks just like this.
You can leave that, you don't need that clamp closed at all.
If I'm going to just put it as a saline lock, then I'm going to do my flush and my positive pressure. If I'm going to hook fluids up right away, I just leave it open until I hook fluids up. It takes a lot of hand dexterity because you don't want to touch where the catheter goes into the skin. If you touch it, then you have a higher risk for contamination, then you have a bacterial phlebitis. So when you're occluding, you want to occlude and you want to do something just like that. Okay. Now, if you don't get the IV, you don't get your flashback to begin with, you go in and you want to stay within your area on the size of a dime. My dime, I'll grab my dime. A dime. Thank you, Chris. Okay, so when I go in, if I don't get any flashback within my dime, I want to, if I go in and I don't get any flashback by the time I get to the dime, I want to hang on to my blue catheter